Since my update to you last month, our national COVID-19 immunization program has made significant progress. Our average daily vaccination rate for July was almost 400,000, surpassing our target of 300,000. We are consistently among the top 3 fastest countries in the world for daily vaccinations per capita and finished some weeks as the highest in the world. We started the month behind advanced countries like Australia, Japan, and South Korea, but finished the month considerably ahead. Our ramp-up has been internationally recognized, and we have been recording daily vaccinations in excess of 500,000 doses. In July alone, we administered 12 million doses. This is more than the 8 million cumulative doses that we had administered from February to June. This shows us what we have always known. What was holding us back was not the lack of capacity, resources, or competency, but rather not having a consistent supply of vaccines due to global vaccine inequity and the hoarding of vaccines by certain countries, which has been condemned by the World Health Organization. In the last weeks of July, we had a very ambitious goal of ensuring 100% of adults in the Klang Valley received at least a single dose, a complex exercise we called Operation Surge Capacity. With the hard work of everyone involved, I am happy to say that we have succeeded in that goal, one that involved immunizing an average of 235,000 doses daily in the Klang Valley alone throughout this period. Thank you to all involved, and we hope to see the inflection point for hospitalization and deaths in the Klang Valley in the next few weeks as people get their second doses. We have now crossed more than 40% of our adult population receiving 2 doses, and more than 50% of our total population has received at least a single dose. 81% of all registered adults have received at least a single dose of the vaccine. These are impressive numbers, but what does this mean in the real world? What does our world-beating vaccination progress translate to in public health outcomes? Let's take Labuan and Sarawak, for example. In Labuan, with the spread of the Delta variant, we had to move swiftly to ensure that the hospitals were not overwhelmed and that there was still sufficient capacity in the ICUs. We expedited vaccinations in Sarawak to prepare for the possibility of state elections. Now in Labuan, 60% of its total population has been fully vaccinated, and in Sarawak, that figure is 56%. Since the start of July, COVID patients in ICU have dropped by 60% in Sarawak and close to 100% in Labuan. Other key data, like deaths and serious hospitalization, are also on a downtrend. We know that the Delta variant is prevalent in both Sarawak and Labuan. Yet, Alhamdulillah, the vaccines are having its intended effect of reducing the severity of COVID-19. So in terms of speed and effectiveness, our immunization program has started to deliver some early positive results, but we must continuously strive to do better, and we will. Our target for August is for 40% of every state's adult population to be fully vaccinated, and we are on track for this. On a national level, this will be 50% of Malaysia's adult population. But beyond the big numbers, our immunization program has been a personal journey for each and every person that has been vaccinated. I would like to think, for the most part, your personal journey has been a pleasant and efficient one. But of course, for some, we may have fallen short of your expectations. I would like to apologize to anyone who has had a bad experience with this program, and I promise we will continue to learn, improve, and strive to do better. We must learn from the few cases of congestion in the Klang Valley to see how we can improve crowd control in other states as we ramp up there. We have just announced that we will be opening walk-ins for special groups in all states very soon. So it is important the SOPs are tightened to ensure that you are safe when visiting PPVs. I understand that there are fears that people might have received empty doses. I can assure you that these are isolated cases, and we have put in safeguards to ensure that they do not happen again. Additionally, I am also aware that some people have decided to take antibody tests. Similar to the Center for Disease Control and the FDA in the United States, we do not recommend doing an antibody test after receiving the COVID-19 vaccine because there are currently no standards for what kind of test is suitable. The Institute of Medical Research under our Ministry of Health is currently conducting a proper study on the immune response after vaccination. We will publish the interim results when they are available. We will also be changing our strategy for adolescent vaccinations, taking into account new recommendations by JKJAV's Technical Working Committee. We have decided to start vaccinating 12 to 17-year-olds with underlying medical conditions in line with the clinical guidelines on COVID-19 vaccination for adolescents. Thereafter, we will be offering the vaccines to all other 12 to 17-year-olds, and more details on the implementation of our adolescent vaccination plan will be announced next week. We are also encouraging more foreign workers and migrants to get vaccinated. We will be working together with NGOs to provide the refugee community their vaccinations soon. People in prisons and detention centers will also be inoculated in the coming weeks. No one is safe until everyone is safe. We had a very good July, and we are on track for our August targets. We need to work hard to get as many people vaccinated as quickly as possible so our economy can open, our people can recover, and our nation can heal. I will not stop until every adult is fully vaccinated by the end of October. That has been my promise to you. I hope I can see this through. After the Battle of El Alamein, Churchill said, "Now this is not the end. It is not even the beginning of the end. But it is, perhaps, the end of the beginning. Let's keep going."